Well, we've been through a number of outbreaks, but I think let me just take one example of the recent one, which was the first one in the country. In March, the year 2023, we had an outbreak on Marburg in Tanzania, which was the first outbreak ever. We've never had a Marburg outbreak in the country. And well, the good thing is that, or the good story behind it is that we were able to control it within a very short time, that is 78 days since the onset of the outbreak. So let me very briefly share with you what were the success factors for us to be able to control that outbreak within that very shortest time. One is the political commitment. I remember when we first had that case, we had very clear instructions from our president, Her Excellency Dr. Samia Suluhu Hassan, who told us, you have to say it because this has to be very open. You have to tell the people what they should do, what they should not do. But immediately she also organized and mobilized resources for us, including financial, but also she instructed all the other ministries related to that outbreak to make sure that they deploy all the necessary equipment, but also staff to the area where the outbreak had taken place. And she insisted that we must comply to all international and national regulations when it comes to outbreaks management. So to us, really, that was a very good success factor. You know, having the president, of the country in the forefront and encouraging you to make sure that you do everything according to standards, but also mobilizing resources for you. So to us, that was one of the success factors. But I think the other thing that I can really share with you is the role of the communities in responding to outbreaks. You know, within our early warning system, it starts from the community. So it was a motorbike driver actually who carried this suspect of Marburg on his motorbike. But he just sensed that something was not right. So he alerted a community health worker that today I carried a person who had something that I did not understand. That was very uncommon illness in this area. And then because that community health worker had already been trained on the alert system, that community health worker posted that information in the alert system within the district, and then the information now started, going around, and the entire alert system was activated. So that's another success factor, that is the community involvement. But again, Tanzania has a pool of health workers who are skilled, okay? And they've been trained on how to manage and to deal with outbreaks. So immediately when we received that information, there was a deployment of staff who were trained on how to manage outbreaks, previous outbreaks, including COVID, but also we had similar threats in the past on I think it was Ebola. So we had a pool of these staff who were trained. So these were the staff that were, mobilized to go and support that particular place where the outbreak had occurred. And imagine, this was a first outbreak in the country. So everybody was like scared. But I want to tell you, our healthcare workers, they were very committed and very ready to go and save. The only thing they requested from the ministry was that we need protective gears. We need protective gears, we need supplies, we need medicine, and we are ready to go. That was very encouraging even to the people in the communities, because they saw the healthcare workers were not scared. So to them also that was an encouragement. Okay, yes, we have this strange disease, but we have our healthcare workers who are ready to support us and to make sure that it doesn't spread to other places. Immediately when WHO was notified, UNICEF, PEPFAR, and all other CDC and all other NGOs, they came to us and they asked us, like, what do you want us to support you? So we had all the support, from technical support, financial support, and other resources, including commodities, etc., etc. And if you heard my minister, she even said that, WHO, UNICEF, they even requested her to go with her to the site, So they traveled all the way from our capital city in Dar es Salaam to Kagera, where the problem was, actually very interior to the village. So to me, actually, these are the success factors that enabled us to be able to contain the outbreak within a very short time. WHO has really been a key partner to our government for so many other things, not only disease outbreaks. So immediately after we alerted WHO, immediately after we sent an alert to WHO, the first thing they did was to provide us with a pool of technical expertise. So really we had a technical support from WHO. And the second thing they did was to mobilize resources for us within the country office, but also in the neighboring regions. I remember them mobilizing resources from Uganda, from Congo and other countries, especially the personal protective gears. But they also mobilize resources from other international, multilateral and bilateral organizations. So really in that particular area, we were very grateful to WHO. But they went further. They also mobilized human resource, skilled human resource, you know, because Tanzania is a huge country. So they were able to provide financial support for us to deploy skilled healthcare workers from other regions which were not infected by the outbreak. So we were able to have a pool of skilled human resource personnel from the rest of Tanzania, all sending there, all targeting one region where the outbreak had occurred. The biggest achievement that I would really want to share in our country, one of them is the reduction of under 5 mortality. Tanzania is one of the countries in Africa that was able to reach the target when we were still implementing the Millennium Development Goals. Tanzania was able to reach the Millennium Development Goals in terms of reducing under 5 mortality before even the end line. And the other thing that I would really want to, achievement that I really want to talk about is us being able to reach the 95 target on the reduction of HIV. Actually, we have surpassed because we are all, one target we have reached 98, the other one 96, and the other one almost 96. Okay, and the other thing that I would really want to share as an achievement is the way our government has been able to build the infrastructure, especially in the primary health care. Now you're talking about 70% of the population in Tanzania being able to access health services within 5 kilometers in their communities. And this is the primary health care that I'm talking about. So this really has also contributed towards the reduction in under 5 mortality, but also the reduction in maternal mortality. We have almost halved our maternal mortality. In 2015, we were talking more than 550, but now we are somewhere close to 250. So it's almost, we have reduced by 50%, okay? So these are mainly the achievements that I can really talk very proudly that Tanzania has really been able to achieve.